Now, using our 3 steps, let's break this down. So this question is asking what to do now for the key problem, that dang student nurse that emptied 300 mLs of urine when you were trying to do a 24-hour urine collection. So guys, you need to start that urine sample, that 24-hour urine, all over again. So our solution that we're looking for is we get a full 24-hour urine sample just to start it over here. So option number 1 and 2 are incorrect. You can notify the instructor, but guys, it doesn't solve the issue of the missing urine. Option 2, you cannot change the testing time. That would be inaccurate. So option 3 is also incorrect. You can't extend the time. It would also be inaccurate. So really the only option here is option number 4, fail that student out of nursing school. I'm just kidding. Option number 4, you need to start all over again, guys. That 24-hour urine, uninterrupted, first thing in the morning. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking for the most appropriate action for the key problem, measuring an NG tube for insertion in a hospitalized patient who's getting a stomach decompression. So guys, the biggest thing we're thinking is the measurement here, since that's what the question's asking. So we always measure from insertion point to the end point. So always remember, from nose to earlobe here down to the xiphoid process. So the solution we're looking for is proper measurement. So option number 1 is incorrect. You need to measure to fit the patient specifically, not that one size fits all. Option number 2 is incorrect. It was almost correct, but it pretty much had the reverse thing. So it's nose to earlobe, not earlobe to nose. Now option number 3 is also incorrect. Tip of the nose, start point, but should follow to the earlobe. And guys, not to the bottom of the last rib. We're going to the xiphoid process. So option number 4 is correct. So one more time here. Tip of the nose, around to the earlobe, ending at the xiphoid process where the ribs meet right here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking, placing in order the key problem here, suction in a patient who is intubated and on a ventilator. So immediately, before looking at the options, you're thinking oxygen, closed system, clean, and the correct PPE here. So solutions we're looking for is the correct steps to suction this patient. So for our options, the first thing we do is wash our hands and put on gloves before any procedure. Then you clean out the patient's mouth. Then the next thing you do is give the patient extra oxygen before suctioning. Then you're advancing that catheter into the airway, and then we're turning on that suction to begin the suctioning process. And then lastly, we're just monitoring the patient. Now, using our 3 steps, let's break this down. Now the question here is asking for the correct statements. For the key problem, the student nurse is caring for a jugular triple lumen, keyword here, CVC, central venous catheter. So that's our focus here. So biggest thing we're thinking about before looking at the options are surgical asepsis, use of ports, and maintaining the patency. So the solution we're looking for are statements that reflects the right thing to do for a CVC. So option number 1, proximal port is used for CVP, so it's incorrect. Option number 2 and 3 are correct. Guys, we always use large size syringes for flushing, like 10 mLs and 12 mLs. We're just talking less pressure on that CVC. And option 3 is correct. TPN can be given through the medial port. And option number 4 is incorrect. Ports that are not being used should be kept on a headlock. And option number 5 is correct here. We need to scrub the hub for at least 10 to 15 seconds before the use to prevent those infections. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for the most appropriate action for the key problem, assisting a physician with key term chest tube removal. So the biggest thing we're thinking is pain, respiratory function, and positioning for removing that chest tube. So the solution we're looking for are the right things to do when helping with this. So option number 1 is the most correct. Since the procedure can cause pain, we need to keep that patient comfortable. Now guys, option number 2 was a very close second. So don't get sad if you chose that one. Technically, you should take a deep breath when chest tubes are removed, but technically it's not the best or priority action before the pain administration of pain meds. Now, option 3 and 4 are incorrect. Supine with head tilted down is the incorrect position, and option number 4 is incorrect. Guys, it needs to be covered with an occlusive dressing. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking for the incorrect action here for the key problem, a nursing student preparing to care for a patient with a nasogastric tube with intermittent feeding. So the biggest things we're thinking here is improper procedure, and we're thinking safety and errors. So, solution we're looking for are the actions that are wrong, that shouldn't be done. So option number 1 and 2 are incorrect here, because they're correct here. So, tap water to flush before and after meds is a correct procedure. Remember, we're looking for the wrong stuff. Option 2, maintaining the head of bed elevated, that prevents aspiration, so it's good. So option 3 is our choice here. All the gastric residual should be put back into the gut. So remember, we're looking for the wrong ones here. So we have to choose option number 3. And option 4, gastric residual should be checked per policy. So we have to skip that one since it's incorrect. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking for the priority action of what to do right now. For the key problem, the nurse places a cath and no urine output is safe. So the biggest thing we're thinking before we look at the options is that there's wrong positioning or placement, or there's a bladder problem. So the solution we're looking for is ensuring correct placement here. So option number 1 is incorrect. Now, you may need a urologist, but this is not the first thing you should do. This is not a priority here. So, first things first, you need to ensure and assess placement first. So, option number 2 is correct. You always leave in a catheter that's missed and reinsert a new catheter higher. Now, this is common for female or obese or even hypospadias clients here. Now, option 3 and 4 are incorrect. Guys, we don't irrigate until we ensure the catheter placement. And option number 4, we don't discontinue. We always leave that missing catheter in place and always attempt a new placement. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking for the most appropriate position for the key problem, a lumbar puncture at the bedside. So guys, whenever you hear a lumbar puncture and the best positioning for it, always think LP for lower puncture for lumbar puncture. So we need access to that lower spine, keep the patient comfy. So the solution we're looking for is a position that gives the best access to that lower area and keeps the most comfort for the patient. So option number 1 is the correct option, basically the fetal position. Knees to the chest while the patient is lying in bed gives the best access for a lumbar puncture, so the patient can lie down comfortably. Now option 2, 3, and 4 are incorrect. Sims access doesn't give the best access to the lumbar area. Option 3, sitting on the side of the bed and resting on the table is not the best access. And option 4 is also incorrect. Trendelenburg, guys, you're lying flat on your back with your head lower. Not the best access for the lower area of the spine. So the correct option here is that fetal position, side lying with those knees on the chest. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. Alright, this question is asking for the incorrect action for the key problem, that student nurse that's changing the dressing and IV tubing of a PICC line for a patient getting TPN. So guys, the biggest thing we're thinking is positioning and technique. So our solution we're looking for is improper action to do this procedure. So number 1 is incorrect. Sterile technique always maintained with central lines. Option number 1 we have to skip because sterile techniques always maintained with central lines. Guys, remember, we're using and finding the incorrect option. So option 2 we have to skip because breathing in deep when changing increases the thoracic pressure, which decreases the risk for embolus. Option number 3 we have to choose because the patient should be positioned in Trendelenburg, which decreases the risk of an embolus. And option 4 we have to skip because it's technically correct. We always wash hands before and after patient care. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. Now this question is asking for a priority or most important assessment for the key problem, post-thoracentesis nursing assessment. So the biggest thing we're thinking, even if you didn't know what a thoracentesis was, guys, we're always assessing lungs and breathing in accordance with the ABCs. So the solution is we're checking respiratory function and addressing patient needs now to avoid that worst possible outcome. So option number 1 That's correct. We're assessing the breath sound. Since a thoracentesis, we're going right into the thoracic cavity. Now, option number 2 is incorrect. Pain doesn't provide an assessment about respiratory function. And option 3, incorrect. Temperature doesn't provide that assessment for respiratory function. And number 4 is also incorrect. Appearance of the insertion site, again, doesn't provide the assessment. Now, using our 3 steps, let's break this down. This question is asking for a priority action. What do you do next? For the key problem, the nurse is attempting to insert a Dobhoff feeding tube. The patient starts coughing forcefully, getting flushed, and becomes dyspneic, or basically difficulty breathing. So immediately we're thinking, guys, airway compromise here. So the solution we're looking for is to clear the patient's airway and prevent that worst possible outcome. So option 1 and 2 are incorrect. Keep advancing the tube will cause more distress. And option 2, melting ice chips into the mouth. Guys, the patient already has respiratory distress, so the patient can already aspirate. Now, option 3 is the correct option. We always stop the tube that's causing the problem and then clear the airway that allows the patient to breathe. Now, option number 4 is incorrect. The tube should be taken out, but guys, allow the patient to recoup before trying it again. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. So this question is asking for the assessment finding for the key problem, a shoulder sling that's an improper fit. So the biggest thing I'm thinking here is something that's not holding the arm up on that affected side. So our solution here are findings that shows that the sling is an improper fit. So option number 1, we have to choose since the hand is below the elbow, which basically means the arm isn't being held up there. And option 2, sling ending in the mid-palm is a good fit since the fingers are unobstructed there. And option number 3, thumbs up because the arm is held up. And option number 4, 45-degree angle is correct and indicates the arm is up. So we have to choose option number 1 that shows the improper fit here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking the likely causes for the key problem of an inaccurate pulse ox reading. Guys, the pulse ox reading is 72 for a patient who's alert with a normal respiratory So the biggest thing we're thinking about is pulse ox that's not reading correctly. So our solution we're looking for are factors that affect that pulse ox probe. So option number 1 is correct. Low blood pressure means low perfusion, which definitely can affect that pulse ox reading. Option number 2 is correct. Our cold fingers, which causes vasoconstriction, meaning low perfusion. Again, interferes with that pulse ox reading. And option number 3 is also correct. Weak pulses means low perfusion. Now option 4 is incorrect. Technically, tattoos on the hands really don't interfere with any type of pulse ox reading. And lastly, option number 5 is also incorrect. High WBCs or white blood cells doesn't interfere with any type of pulse ox reading. So guys, just remember and just think pulse ox, think perfusion. Okay, that wraps it up. For more details and now using our 3 steps, let's break this down. This question's asking for the appropriate nursing actions for the key problem preparing to give a patient with anemia a blood transfusion or packed red blood cells. So biggest thing we're thinking about before we go to the options here, we have to have a patent IV, correct equipment, and closely monitor those vital signs. So solution are correct things to do for the patient. So option number 1 and 2 are incorrect. Blood is not to be connected with any other fluid except normal saline, guys. Write that down, normal saline with blood transfusion. Option 2, packed red blood cells are given through the main line, not through an IV piggyback. And option 3, 4, and 5 are correct. You need to have a large bore IV or a blood transfusion to avoid lysis. Option 4, heparin and blood are not to be given together. Guys, we never give anything together with blood, so no medications with blood. Blood's just a standalone. And option number 5 is correct. You need to have vital signs before starting any type of blood transfusion and monitor vital signs throughout. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. This question is a knowledge-based question, asking for the most appropriate crutch gait. For the key problem, patient is instructed to progress to a full weight bearing on that leg that was previously fractured. So guys, keywords we're thinking for is using both legs and both crutches here. So solution we're thinking about is walking that demonstrates that all 4 points are in contact and are used separately. So option number 1 is incorrect. Only 2 shared points of contact and it's partial weight bearing. Option number 2 is incorrect. Only 3 shared points of contact. Guys, it's non-weight bearing on that 1 foot. So option 3 is our correct option. All 4 points are in contact with weight bearing support. And option number 4 is incorrect. No 5-point gate here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. Alright guys, this question was a little bit tricky if you don't know the correct order for an NG tube placement. So the ask here is place an order, the key problem, insertion of a nasogastric tube. So guys, we're following this technique. So it's definitely a knowledge-based question. So first is option number 1. Guys, we always wash the hands before and after care and always apply gloves as standard precautions. Now, step 2 is option 4. We raise the patient to proper position for the insertion. Now, step 3 is option 5. We always measure that nasogastric tube and mark where the tube will end and be secured. And step 4 and 5 here. Option 2, begin inserting the lubrication tube carefully. Step 5. Option 6, advance that tube until the mark is reached. And lastly, step 6 is option 3. Make sure the tube is placed in the right spots and secured in the right place. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking for the incorrect action for the key problem, that nursing student that's administering a soap suds enema. So the first thing we're thinking before we even look at the options are safety, comfort, and privacy. So the solution we're looking for is the improper technique with this procedure. So the incorrect options here. So option number 1, we have to skip since it's the correct way to do it. We put the patient on the left side with their right leg flexed. That's a proper way to instill an enema. Now, option number 2 is the improper way to choose it. Instilling cold enema fluid, guys, that's going to cause cramping. Always warm fluid. Now, option number 3, we had to skip because it's the correct option here. Slowing down that flow if the patient is experiencing discomfort. And the same with option number 4, we have to skip because we're looking for the incorrect options here. So, patient should hold the enema as long as possible for the best effect, letting that fluid soak into the bowels. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. Now, this question is asking for incorrect actions for the key problem, the nursing student preparing to irrigate fresh wound on a child. So we're thinking here, asepsis and pain. So the solutions we're looking for are actions that are not to be done here. So technically speaking, option number 1, we have to skip. Guys, a mask and face shield are used to protect from splashing. And option 2 and 3 are technically the right things to do, so we have to skip them. So pain meds are given because the procedure can hurt. And option 3, you have to keep that skin dry to promote healing. So option number 4, we have to choose it. We have to clean the wound in to out to prevent the infection. So this one we had to choose because it was the correct option here. Going out to in can introduce more infection. Okay, that wraps it.